Good afternoon. My name is Kathleen Stanford, a healthcare worker and master's candidate in exercise physiology at the University of North Carolina. I'm excited to present to you a review on exercise medicine on campus at the University of North Carolina at Chapel Hill. A little bit of housekeeping here. This is a quick overview of what I'm going to cover in my presentation this evening. We'll start with an introduction and introduce what the program Exercises Medicine is and what our goals are. Secondly, I'll introduce the methods that our program implemented during COVID-19. The three main modes of adaptations that we brainstormed and implemented were for consults, resources, and communication. Then I'll talk about the results. We'll compare the participation numbers after March 2020 when we implemented the changes, and then compare those to the numbers before. Then we'll conclude and then open up for questions. So first, I'd like to introduce the organization itself. What is Exercises Medicine, or I'll frequently abbreviate it EIM or EIMOC? Exercises Medicine on campus is an initiative by the American College of Sports Medicine. The organization is present in college campuses around the world, and its mission is to promote physical activity as a vital sign of health. It's also to assess physical activity at every doctor's visit, provide counseling to students on how to incorporate exercise into their daily routine, and make movement a part of campus culture. The program is designed to coordinate campus resources to promote behavior changes related to physical activity among students. These changes are driven by motivational interviewing to find out what interests the participant has or what obstacles each participant has that may prevent them from exercising. The team focuses on developing plans to work around these obstacles. So these are our core goals at EIM-OC at UNC. We first want to establish movement as part of the daily campus culture, which includes works to spread news about physical activity benefits for health and happiness. Secondly, we want healthcare providers to be assessing physical activity at every student health visit, which ACSM has called physical activity as a vital sign. Currently at UNC, Campus Health is asking patients about their physical activity, which is very helpful. This was after a very long process to add the question into the electronic medical record, but it can be done. The program also seeks to give students the tools necessary to strengthen healthy physical activity habits that can last a long time, that can last a lifetime, as they are impressionable and learning to be independent at their age. We want to create healthy students and healthy alumni by teaching students to exercise while at UNC. Lastly, we focus on connecting university healthcare providers with university health fitness specialists to provide a referral system for exercise prescription for student participants. These are the components of our team at UNC. So Dr. Stoner is the advisor for EIM. At Campus Health, we have many different providers, and these include MDs, nurse practitioners, physician's assistants, PharmDs, and registered dietitians. Campus Recreation is a great resource at North Carolina. Oh, I'm trying to get my laser pointer here. Campus Recreation is a great resource at Carolina, and this is Lindsay, so she's our liaison. At Campus Rec, they offer group fitness, rock climbing, swimming, barbell, cardio, dance, yoga, and cycling. And of course, all of these have been complicated by COVID-19. But they keep coming out with new online classes and also new outdoor classes as we sort of move into the year. And so Lindsay keeps us up to date on the changes within the offerings in Campus Rec. We also offer local resources as well for students who live in Chapel Hill, and we'll describe this a little bit later for those who no longer live in Chapel Hill. We also use health apps like Peloton, Les Mills, Down Dog. And so those are all part of our health fitness professional group here. Lastly, the student representatives, me and my good lab partner, Alex, we are the EIM student representatives. So the 4 components shown earlier, this is how they all come together in this process here. So it begins with a visit the student will visit their primary care provider at Campus Health, and their provider will ask about their physical activity level. And this is to see if they're meeting the 150 minutes of weekly activity. If they are not, the primary care provider will refer this student to the EIN representative. So here they'll be referred to the team. The EIM OC team will reach out to the student or to the participant to make an appointment for a consultation at a time that suits them. At this consultation, this meeting, the EIM team member asks the participant about their current level of activity, exercises that interest them, and also any limitations they may have that prevents them from exercising a particular way. Personal goals are set, and the appointment then concludes. No later than 48 hours after the meeting, the EIM team emails a personalized resource sheet with several options for finding movement, such as group fitness classes offered by Campus Rec, to one of the fitness applications that we recommended before, or any other local resource that the participant might be able to use. So to break it down further, the two main questions we want the healthcare provider to ask their patient is how frequently do you exercise per week? And then how long are your exercise sessions? And as we noted before, this is to get to the statistic 150 minutes of light to moderate physical activity per week. So if they are not meeting this, or if they have a condition such as ADHD, diabetes, anything that could find benefit from physical activity, they can recommend the student to the EIM team. So next, Alex and I would meet with the participant during our consultation meeting and discuss why they sought help from EIM and what they hope to achieve from it. We also discuss any limitations from injury or medical conditions, what kind of physical activity they're interested in, what their background is in terms of education, job, and living situation. We also find out what their baseline physical activity levels are, and then more recently we've asked about the participants' location, since many students don't live in Chapel Hill due to remote learning, and this is one of the changes we've made. We'll talk about that further along in the presentation. All right, so lastly, a resource sheet is then emailed to the participant within 48 hours to offer the exercise prescription and the affordable opportunities to be active based on their preferences determined at the consult interview. So here's a sample of perhaps a resource sheet that we made for Jane Doe here. We have goal setting, as you can see under here with the little pointer, and then we have more weekly goals. This varies drastically between students or between participants. They're recommended to try some of the activities listed in the columns. They don't have to try all of them. And we also try to offer many different methods to complete those exercises. So for example, in the yoga section, you can see there's an app recommended. There's also a YouTube channel recommended. And then there's also outdoor yoga classes recommended by UNC Recreation. So the participants can find the best method for their lifestyle to incorporate yoga into their routine, as an example. All right, so we're going to move on to the methods. So when COVID-19 reached North Carolina, like other places, campuses, parks, and gyms all shut down, leaving students who wanted to begin new workout routines lost. And then in other students, it upset their routines for those who were already active. They may have already had a routine of physical activity, and all of a sudden their routine is upset by all these closures. So the EIM team quickly brainstormed and implemented changes that targeted three main modes affected by closures. One, the consultations needed to change because they took place in person, usually at the local coffee shop or on campus. So that was no longer a safe occurrence. Secondly, our go-to resources became obsolete or restricted due to government restrictions. And thirdly, our in-person meetings and presentations with campus health providers could no longer be completed safely. So beginning with consultations or consults, we switched from in-person meetings to Zoom. So while this seems like an obvious change, we received very positive feedback from participants. With the newly created scheduling tool, booking appointments became easier. And for one, there was no commute to a meeting spot, no commute to campus or a coffee shop. allowing for more flexibility in the participant schedule, as well as for the EIM representative schedules as well. Some literature also suggested that meeting online is less intimidating for certain students than an interview in person, which really improves EIM's approachability. Follow-up appointments were also made at the initial appointment. This was a change from emailing the participants a few weeks later, which was very unsuccessful. They typically did not respond to any emails after the consultation. So scheduling a second appointment was done to improve retention. All right, so resources have changed greatly as of March 2020. Students were spread all over the place after campus closed. So we used to have recommendations for students pretty much specific to Chapel Hill. We didn't really talk about any opportunities to exercise outside of campus. And so many students cited closure of their favorite facility as reasons they've stopped exercises. And so we had to become very creative in making sure we can locate resources for students wherever they may be. And therefore, when campus did reopen, we maintained a close relationship with our liaisons at Campus Rec to make sure our participants knew of facility hours, distance group fitness classes, pool openings, and other safe events. This was to promote awareness about safety protocols, as well as what fitness opportunities were in fact open and available. So one point to make is that the changes we've made in resources has continued to evolve as things have started to reopen. So it's a very dynamic process. So most of the major parks have reopened, but we still check with the ones near the participant's location to ensure it is usable. This was more of a problem last year, but it still remains the case in many places. Many on-campus facilities have opened, as we mentioned. Safety measures are in place, often requiring an appointment. And so on our resource sheet, we would provide a link for someone to sign up for swimming in a lane in a pool, or gyms are by appointment as well. We can provide the link for them to sign up to work out at the gym. The fields on campus are also open for use. And so we try to make sure that students are aware of those. And also we try to promote walking and biking trails that are local to campus because a lot of students simply don't know about them. Lastly, let me back up one more point. Outdoor workouts have become quite popular. This should say campus recreation, I'm so sorry. Campus recreation has incorporated outdoor workouts in many spaces on campus, and also private fitness companies, particularly those that are affordable or offer discounts for students. We tend to put those on the list as well. So for here, this is an outdoor workout place in Raleigh. Applications are also very popular and have very much expanded since COVID-19 occurred. And again, we look for apps that are high quality in nature. We often try them out ourselves to make sure that they are worth it. And again, we seek for applications that are either free or affordable or offer discounts for students. And the same goes for live and on-demand classes. We've located several resources that are on YouTube or on Facebook Live or offered by Campus Recreation so that students know about them and can use them. Lastly, our communications with Campus Health evolved from in-person meetings to educate providers on our program, as well as the latest relevant research demonstrating exercise benefits to varied conditions. So I mentioned ADHD earlier. We also provide literature on exercise and generalized anxiety disorder, diabetes, and fibromyalgia. We converted EIM's literature talks to a weekly newsletter, as well as a blog. And we've also been meeting with other groups within Campus Health away from primary care, including PharmDs in pharmacy. And this is to continue promoting referrals from PCP. So we want every provider in Campus Health to be aware of EIM so that they can recommend it to their patients. And this communication helps providers stay up to date about the importance of physical activity and the role EIM plays in students' health. So we've had some good success with this newsletter and this blog. So listed here is a summary of the changes during consultations, resources, and the communication that we've provided. And again, just an overview for consults, we've moved from in-person to Zoom. We've created an online scheduling tool. And we schedule the follow-up appointment at the first meeting. We don't send an email a couple weeks later. They tend to delete it. Resources. Research and utilize new apps such as Peloton, Nike Training Club, Down Dog, All Trails, particularly ones like All Trails that can find walking and running resources close to the participants. So it's actually, it will find local areas for them to move around outside. And of course, Peloton, people associate with the bike, but they have yoga, they have weight training, and even a running form on their app. So it's not just for the bike. Also identify fitness opportunities local to the participants. We've talked about that. Not all participants are in Chapel Hill anymore, and that's still the case. Finally, keep resources up to date from campus recreation so that students are aware of any changes. And then to touch back on communication, expand the reach within campus health, including primary care, counseling, and pharmacy. Make sure that the science is still moving, is still being communicated, even if you can't communicate in person. Move those presentations into different forms of media. And then also present changes to various committees and campus groups to promote exposure for EIM for continued referrals. All right, so we are in the results section now. So we'll demonstrate the changes in participation numbers since EIM OC adopted these adaptations to COVID-19. So we look on the right here, we can see referrals in red, consults in blue, follow-ups in green. And then this shaded box here indicates dates after March 2020. So this is when the pandemic occurred, and it happened to be this point right here. We didn't have any referrals in March. This is where we implemented the changes. So it was the same month that the pandemic occurred. So a couple comments. The first peak, the program's inception was February 19th. The first peak was the start of the recruitment efforts. And you can tell when the students go on break during the summertime, and also for winter break, that they are, the students usually are away from campus and our referrals and consults drop. But our referral monthly average was only 1.77 students prior to COVID-19 adaptations. And that increased to an average of 6.67 per month for the 10 months after the changes. So that's an average monthly referral increase of nearly 300%. Additionally, consults, which is when the student actually meets with an EIM professional, those were less than one person per month prior to adaptations and increased to 2.5 consults per month. That was an increase of 180%. And then finally, follow-up meetings, which is when the individual has met in a consult, but then is met again for a follow-up meeting. These actually were non-existent prior to our changes. We had a really, really hard time getting students to commit to a second appointment. And so we went from 0 follow-up meetings to a total of 17 over the 10 months after we implemented the changes, which is a great success in our program, because then we can see if our recommendations were useful or not. So here's another way of seeing how our numbers have changed pre and post program changes. So note that this first time period is 13 months. The second time period is only 10 months. So clearly you can see referrals, as in the number of patients referred to EIM from campus health, was 23 prior to changes and nearly doubled after. Similarly with consults, we went from 12 prior to the changes to 24. So that one did double. And then as we brought it before, we did not have any follow-ups prior to our changes, and we've garnered 17. And we finally have a little yellow on the bar. A little yellow bar on the graph to show that. So a couple notes. COVID-19 may have caused more students to seek primary care. And so it is a possibility as to why we saw such an increase in these numbers. But like we mentioned before, the virtual meetings may have been less intimidating or more favorable to students. They may have preferred that to an in-person meeting. It provided flexibility in scheduling and rescheduling appointments, which is very, very good at getting people to sign up, because then they feel like they can change if something comes out. And finally, we did market ourselves more in the last couple of months, despite not being able to meet in person, which really increased our visibility and our likelihood that a patient would be referred by a primary healthcare provider. So the take-home point is that EIM OC at UNC, referral numbers, consult numbers, and follow-up numbers all increased from April 2020 to January 2021 after the COVID-19 adaptations. The EIM OC process can be modified successfully despite fitness facility closures and access to exercise, or excuse me, challenges to exercise access. So we hope to report our findings and spread the word about our process in hopes that other exercise is medicine on campus organizations or other physical activity initiatives can use these ideas to maintain or improve their numbers despite complications from COVID-19. Thank you so much for listening. I'd like to offer my contact information if you have any additional questions, which we'll also have after this presentation ends. I'd also like to offer a QR code if you would like to read the abstract in its entirety. But again, thank you so much for listening, and I hope we can have a great discussion.